Have you ever wondered why something that once felt simple, natural, and even comforting now feels different as you get older? Maybe the desire is there, but the response isn't the same, or the energy isn't the way it used to be. And you start asking yourself, is this normal or is something wrong with me? I'm Dr. Rosalia Viterbo, and if you're an older man or you care about one, this conversation matters more than you think. Because masturbation isn't only about pleasure, it's about confidence. It's about staying connected to your body, and it's a surprisingly powerful marker of your overall health. Yet most men reach their 50s, 60s, or 70s, never learning how their changing hormones, nerves, and blood flow affect their solo experiences. No one teaches you how to adapt. No one explains what's normal. And very few doctors talk about the subtle signs your body sends when it needs a little more support. So today, I want to give you something simple and honest. 5 doctor-backed secrets older men wish they had known sooner, because they would have saved them years of worry, frustration, and silent confusion. If you've ever felt slower arousal, weaker erections, longer recovery times, or even a sudden dip in desire, don't worry. These shifts are common, they're fixable, and once you understand what's happening inside your body, things start to make sense again. Stay with me. This might be the first time someone explains this in a way that's calm, respectful, and made just for you. As you move through your 50s, 60s, and beyond, your body starts to communicate in quieter, more subtle ways. The signals aren't as loud as they were when you were younger, but they're still there. And one of the places you notice those shifts most is during masturbation. It often starts gradually. A little less sensitivity, a bit more time needed to feel aroused. Erections that don't stay as firm as before, or a climax that feels different, sometimes softer, sometimes slower. Many men don't talk about this, even with close friends. They assume they're alone. They assume it's a sign of weakness. Some even assume it means they're losing their masculinity. But in reality, these changes are deeply connected to the natural process of aging. Your hormone levels shift. Your blood vessels stiffen. Your nerves need a bit more stimulation. And stress, fatigue, medications, and chronic health conditions can all affect how your body responds. What makes this harder is the silence around the topic. Men grow up without clear guidance about what to expect later in life. So when changes happen, the first reaction is often fear. Is this normal? Is this a warning sign? Is something wrong with me? And here's something important to remember. Your sexual response is a reflection of your overall health. It doesn't exist in a vacuum. It's connected to your heart, your brain, your hormones, your emotional well-being, and even your confidence. Think about this. If your desire drops for a week or your erection feels weaker for a month, do you immediately think you're failing? Or do you pause and wonder what your body is trying to tell you? Most men choose the first reaction, but your body always has reasons. The truth is, masturbation can actually give you early clues about circulation, prostate health, nerve function, and stress levels long before symptoms show up in other parts of your life. So before we get into the solutions, let's remove the shame, the fear, and the confusion. You're not broken, you're not alone, you're simply experiencing a natural shift. And once you understand it, you'll know exactly how to work with your body instead of fighting against it. Let's go through the 5 masturbation secrets older men wish they had known sooner. These aren't tricks or shortcuts. They're real physiological explanations that help you understand what your body needs now, because it's not the same body you had at 25. And that's completely okay. First, your body needs more warm-up time, and that's a good thing. As you age, blood flow slows a bit. Your nerves respond more gently. Your testosterone naturally dips. So arousal becomes less like a light switch and more like a dimmer. It still works beautifully, but it needs a moment to brighten. Most men think this delay means something is wrong. It doesn't. What it really means is your body is asking for a different rhythm. Start slower. Use your breath. Let touch be intentional, not rushed. Dry, quick stimulation often backfires. They create friction, but not true arousal. Warming the body, relaxing your pelvic muscles, and letting your mind catch up to your physical sensations can completely change the experience. Think of it as giving your body time to download the signal. When you do this, erections become stronger, climax becomes easier, and the entire experience feels more connected. Second, Lubrication is not optional, it's essential. Many older men skip this step because they never needed it before. But your skin changes with age, your natural oils decrease, and less lubrication means less stimulation for the nerves in the head of the penis. Using a good lubricant isn't a sign of aging, it's smart anatomy. It reduces friction, protects the skin, and enhances sensation dramatically. Most men tell me the same thing once they finally try it. I can't believe I waited this long. A small change creates a huge difference in comfort, pleasure, and even erectile response. Your body deserves that gentleness. Third, your erections reflect your circulation more than your libido. This is one of the biggest surprises for men over 60. You may still feel desire, you may still feel mentally ready, but your erection may not follow as quickly or as strongly. That's because blood flow, not just testosterone, drives the physical response. If you walk less, if you sit more, if you've gained weight, if you have diabetes or high blood pressure, your penis will often be the first place to show it. The good news? Improving circulation doesn't require dramatic change. A 10-minute walk, stretching your hips and lower back, deep breathing to relax your pelvic floor, staying hydrated, even a warm shower before you start. These small habits make a large impact. Your blood vessels open, your body warms, your erection finds its strength again. When men understand this, they stop blaming themselves and start supporting their health in a real, sustainable way. Fourth, your mindset plays a bigger role now than it did in your 20s. Younger arousal is driven heavily by hormones. Older arousal is influenced more by the nervous system. If you're stressed, distracted, or anxious, your body shifts into a protective mode. That makes arousal slower and climax harder. And here's the part many men don't realize. Worrying about performance can completely shut down pleasure. It's not psychological weakness, it's biology. Your brain needs to feel safe, relaxed, and present for full arousal. A quiet moment, a comfortable space, a slower pace. These aren't luxuries, they're requirements for the mature male body. When you give yourself permission to enjoy the process, rather than rush to the outcome, your body responds with more consistency and more pleasure. Finally, recovery time increases, and that's normal physiology, not failure. Younger men can often have a short refractory period. For older men, this period naturally extends, sometimes hours, sometimes a day, sometimes longer. This doesn't mean your libido is disappearing. It means your nervous system and your hormone levels need more time to reset. Many older men push themselves to climax again quickly, thinking they can train their body. But forcing it usually leads to frustration and discouragement. Instead, listen to your body's timing. Your recovery period will be more predictable if you're sleeping well, managing stress, staying hydrated, exercising gently, supporting your testosterone naturally. When you stop fighting your biology, the experience becomes smoother and far more enjoyable. And remember, arousal without climax is still healthy. Stimulating blood flow maintains tissue oxygenation. It supports prostate health. It improves nighttime erections. It keeps your sexual system active, even if you don't finish every time. These 5 insights are simple, but they can transform the way you understand your body. Older men often tell me that once they learned these fundamentals, their experience became less stressful and far more satisfying. Your body isn't declining, it's evolving. And when you work with that evolution, not against it, you feel more in control, more connected, and often more confident than you have in years. Let's take a moment to bring everything together, because understanding these changes truly gives you back a sense of control and confidence. What you're experiencing isn't a loss of masculinity. It isn't a sign that something is broken. It's your body communicating with you in a new way. And once you know how to listen, everything feels a lot clearer. We talked about how your body now needs more warm-up time. That's not weakness. It's simply the natural shift in blood flow and nerve response as you age. When you allow yourself to slow down, your body actually performs better. Your arousal grows more steadily, and your pleasure becomes deeper and more consistent. You also learned that lubrication isn't an optional step anymore. It's part of protecting your skin, enhancing sensation, and making the entire experience more comfortable and enjoyable. Small adjustments like this often create the most noticeable improvements. Then we looked at circulation. Your erections are one of the earliest signals of your overall cardiovascular health. By supporting your heart through walking, stretching, hydration, and simple breathing, you also support your sexual function. This is one of the most empowering connections for men to understand. We talked about mindset too. As you get older, your nervous system becomes a bigger part of the equation. Stress, distraction, or pressure can interrupt arousal, even when your desire is strong. When you approach the experience with calmness and presence, your body responds more naturally. And finally, we acknowledge that recovery time changes. Your refractory period grows longer, not because anything is failing, but because your hormones and nerves reset at a different pace now. Respecting that timing brings ease back into your experience instead of frustration. If you take only one message from this video, let it be this: your body is still capable, your pleasure is still valid, and sexual health evolves. It doesn't disappear. Always listen to your body. Be patient with yourself. And remember that these changes are common, normal, and fully manageable with the right understanding. You deserve confidence. You deserve comfort. And your body still has so much to offer when you give it the care and attention it needs. If today's conversation helped you understand your body a little better, I'm glad. So many men keep these questions to themselves, and the silence only creates more worry. You don't have to navigate these changes alone. Reliable, clear, and compassionate medical guidance can make every stage of aging feel more manageable and even more empowering. If you'd like to keep learning about your sexual health, your hormones, your prostate, and the simple habits that support strong energy and confidence as you grow older, I invite you to stay connected here. Subscribe to the channel. It helps you receive trustworthy, doctor-led explanations made specifically for adults who want real answers, not judgment, not confusion, and not guesswork. And if there's a topic you want me to cover next, feel free to leave it in the comments. Your questions shape future videos, and I'm always grateful for the chance to guide you with clarity and respect. Thank you for spending this time with me today. Take care of your body, take care of your health, and I'll see you next time with more insights to keep you informed, confident, and supported as you age with strength and ease.